President Trump says he received an MRI recently and it was perfect. According to Trump, doctors were amazed. Some say they've never seen an MRI like it before. The machine, he added, did the whole thing, which is generally what MRIs do, though this one apparently did it better than most. Let's take a look at the clip.
The readout from Walter Reed mentioned advanced medical imaging. Did you get an MRI? Can you tell us what that was?
I did. I got an MRI. It was perfect. Yeah. I mean, I gave you the full results. We had an MRI, and in the machine, the whole thing, yeah. And it was perfect. Yeah.
Did you say what in particular?
You could ask the doctors. In fact, we have doctors traveling with us, but I think they gave you a very conclusive. Nobody has ever given you reports like I gave you. And if I didn't think it was going to be good, either I would let you know negatively, I wouldn't run, I'd do something, but the doctor said some of the best reports for the age, some of the best reports they've ever seen.
Trump emphasized that he gave reporters the full results, which consisted of saying the MRI was perfect several times. The White House has not released any medical documents, but Trump said the report was very conclusive and that nobody's ever given reports like I have. And now here's where it gets a little interesting. His team claimed the visit was for a regular physical, but MRI scans are not done at routine physicals. They're for diagnosing serious conditions. You don't get an MRI because everything's perfect. You get an MRI because a doctor is looking for something specific, a problem they need to investigate. Very weird. Sources familiar with the situation say MRIs are not usually rated on a perfection scale. But that didn't stop this one from setting a new benchmark in medical imaging. Radiologists across the country are reportedly reassessing their standards, which one anonymous technician said it's hard to compete with perfection. The president also noted that his doctors described his health as some of the best they've ever seen, which is encouraging news for both him and the MRI community. It remains unclear what the test was actually for, but the goal was to prove that an MRI can, in fact, be perfect. The mission appears to be complete if that's what they were trying to accomplish. And speaking of medical excellence, it's also now officially consecutive week number 2 of Trump bragging about his cognitive tests. Going to roll the clip in a second, but just a quick reminder here, if you're enjoying this video, take a moment to subscribe to support the fight against fascism. Okay, clip.
They have Jasmine Crockett, a low IQ person. They have AOC's low IQ. You give her an IQ test, have her pass like the exams that I decided to take when I was at Walter Reed. Those are very hard, they're really aptitude tests, I guess, in a certain way, but they're cognitive tests. Let AOC go against Trump. Let Jasmine go against Trump. I don't think Jasmine, the first couple of questions are easy. A tiger, an elephant, a giraffe, When you get up to about 5 or 6, and then when you get up to 10 and 20 and 25, they couldn't come close to answering any of those questions.
Time. Okay. Trump is constantly bringing up these IQ tests and how well he did and how amazed the doctors were that he aced every question every time. And he's still, once again, challenging Representative AOC and Representative Jasmine Crockett to take these IQ tests. He wants to pit his genius against theirs to prove once and for all who's smarter. But the best part about all of this is these are not IQ tests. There is a very, very good chance that these are dementia screening tests. Dementia screening tests are only administered to people showing signs of cognitive decline to evaluate how far they are in their dementia journey. The tests ask you to identify animals such as duck and rhinoceros, and to remember a few words and to draw a clock. It's designed to detect severe impairment. But Trump keeps talking about these tests like he won a Nobel Peace Prize. The testers, it seems, told him, the child that he is, that these are IQ tests, that he scored amongst the top, and he's believed them. And he's been talking about it ever since. And so the president of the United States repeatedly brags about passing this test designed to determine if you know what year it is or what a giraffe looks like compared to a rabbit. And he wants to challenge sitting congresswomen to take it against them. That's where we're at. And fresh off of his perfect MRI and clean bill of health, Trump headed to Tokyo for a meeting with Emperor Naruhito. The internet had some observations about this arrival video. Trump's arrival, especially following his weird culty dance moment in Malaysia this weekend. One comment read, "He's still dragging that leg like a stroked out hog on its last tour of the slaughterhouse." Another said, "Hello, welcome, uncultured orange man who knows nothing about trade." The two engaged in what can be described as maybe a handshake that lingered a little too long. The poor emperor appeared increasingly uncomfortable as the handshake began as a standard diplomatic greeting and then entered into a phase of confusion. The emperor clearly wanted out, but Trump kept holding on, uncouth, and oblivious to the discomfort he was causing. Then Trump made it worse. He made a light pat on the emperor's back, grabbing and pushing in a way that most Japanese folks would never do, especially not to the emperor because it's pushy, rude, and a total violation of Japanese protocol when greeting the emperor of Japan. Again, the handshake continued for several additional seconds with the emperor visibly trapped in the uncomfortable handshake zone before eventually concluding in what looked like the emperor's relief at finally being released from Trump's weird hand. Experts in body language described the exchange as an unusually sustained display of Trump's complete disregard for diplomatic norms. The moment served as yet another gentle reminder of how Trump operates on his own timeline, even in handshakes. Despite enduring the extended contact with grace, the emperor maintained his composure. Trump naturally later described the meeting as very warm and tremendous, adding that the handshake was one of the best anyone's ever done. But while Trump's busy violating diplomatic protocol and making international leaders uncomfortable, a real crisis is unfolding out west in Utah and Arizona. The nation's second largest measles outbreak in 2025 is spreading beyond the epicenter, now along the Utah-Arizona border, and it's a preview of what happens when vaccine skepticism becomes mainstream. As of Wednesday, there are 123 confirmed cases, concentrated in the twin towns of Colorado City, Arizona, and Hillsdale, Utah. But it's no longer contained. Cases have appeared in larger tourist destinations like Hurricane and St. George, which are near Zion National Park. What started in schools has become community spread, with exposures now occurring in hospitals and urgent care facilities. Local health officials weren't surprised. David Heaton is the public information officer for Southwest Utah Public Health Department. He said that they'd been preparing for this outbreak. It was just a matter of time before measles arrived. Why? Because vaccination rates in these communities had already collapsed far below the 95% threshold needed for herd immunity. Let's look at Iron County, Utah. Only 82% of kids are vaccinated. Washington County is at 79%, and Mojave County, Arizona has dropped to just 78%. Most cases are among unvaccinated school-aged children. 5 of Utah's 6 measles-related hospitalizations are in this outbreak center. Nationwide, the U.S. reported over 1,600 measles cases across 42 states this year. That's the highest number in 33 years. During the 2024-2025 school year, a record-breaking 4% of kindergartners had vaccination exemptions. That's about 138,000 kids. That number is up from the previous year, continuing the post-pandemic trend of declining vaccination rates. 77% of counties nationwide have reported declining childhood vaccination rates. Here's the critical detail. Nearly all of these exemptions are non-medical. These aren't kids who can't be vaccinated for legitimate health reasons. These are kids whose parents have chosen not to vaccinate them based on beliefs, fear, or misinformation about vaccine safety. It's ideological opposition to vaccines, not medical necessity, that's causing people to say no. Communities are making a choice that's now filling hospital beds with preventable cases of measles. And this outbreak is unfolding all as RFK Jr. has been nominated and taken control of the Health and Human Services Department. RFK Jr. is a prominent vaccine skeptic who has spent years spreading anti-science misinformation. including the thoroughly debunked claim linking vaccines to autism. He's questioned vaccine safety and efficacy repeatedly and led anti-vaccine advocacy organizations. And while kids are being hospitalized with a totally preventable disease like measles, what is RFK Jr. focused on? Well, he's been celebrating what he calls MAHA wins, Make America Healthy Again, posting about food dyes and pretzels on his social media. Caring more about Red 40 than measles vaccines is a really solid exercise in misplaced priorities. Red 40 is a food dye that almost nobody is harmed by, and I'm allergic to it. And any side effects are minor and rare. Measles, on the other hand, is highly contagious and can be deadly, and will happily exploit anyone who hasn't been vaccinated. Focusing on a food dye while ignoring a disease that can literally kill children is not a smart thing to do. People say it's like rearranging chairs on the Titanic, or in this case, it's like reading nutrition labels on candy bars during a flood or natural disaster. Think about the timing here. We're seeing record high vaccination exemption rates and the worst measles outbreak in 3 decades. Now, a vaccine skeptic may say, well, soon the nation's health apparatus will be controlled. The very institutions responsible for tracking these disease outbreaks are going to be recommending new vaccination policies and maintaining public trust in immunization programs. But this is what happens when misinformation goes mainstream. Parents in Utah and Arizona didn't wake up one day randomly deciding vaccines were dangerous. They were influenced by years of anti-vax rhetoric that's been amplified, normalized, and increasingly legitimatized in political circles. The result? Real kids in real hospital beds with a disease we essentially eliminated in the United States 2 decades ago. When ideology replaces science in public health decisions, people get sick, children get hospitalized, and outbreaks that were totally preventable become inevitable. If the MAHA heads need something self-righteous to champion, let's talk about food stamps. If you're genuinely concerned about what's going into your kids' bodies, maybe start with making sure that they actually have bodies that can actually be fed. The government shutdown started on October 1st, which means SNAP benefits, what people call food stamps, won't be issued until November. And these are food benefits people desperately need to stay alive. Now, the USDA is saying there's no money for November. States are being told to hold off on processing benefits. And the worst part, there's already actually a $6 billion contingency fund sitting there ready. There's emergency money specifically for SNAP benefits like food stamps, but the USDA is refusing to use it, claiming it's not legally available for regular benefits. Meanwhile, this means 42 million people are wondering how they're going to feed their families. 1 in 8 Americans rely on SNAP. It's an average of $187 a month or $6 a day for food. That's already barely enough. And now even that's being taken away. Banks are already stretched thin. They can't possibly make up for the $8 billion lost in benefits. This is a crisis and it's completely avoidable. So yeah, 42 million people are being harmed by something very real and entirely preventable, and it's not food dye. The health officials in Utah saw the measles outbreak coming. They were prepared for it because vaccination rates told them it was only a matter of time. The question now is, what happens when the people leading our national health and food policy are more concerned with pretzels and food dyes than preventing disease outbreaks and feeding hungry Americans? We may be about to find that out.
Love this video? Support independent media and unlock exclusive content, ad-free videos, and custom emojis by becoming a paid member of our YouTube channel today. You can also gift memberships to others. Let's keep growing together.